Well, all across South Mississippi, conversations are being had in homes about mental health, behavioral health, emotional health. And today we're going to talk to Danae Smith about what you guys offer here at Gulfport Behavioral Health System. How are you?
I'm wonderful. How are you?
Thanks for joining me. I'm great. So tell us a little bit about what you do here. Okay,
so I am the Director of Admissions here at Gulfport Behavioral. We are a 92-bed inpatient psychiatric and substance abuse facility. We serve patients from age 4 all the way into adulthood. So we offer assessments 24 hours a day, 7 days a week. There's always a master's level professional, mental health professional within the department that can give either virtual assessments or in-person assessments. We assess for level of care and we admit the patient if they meet criteria for inpatient services, or we connect them with outpatient services if that's necessary as well. And we do have an intensive outpatient program that we offer for adolescents and adults.
Now, is this services that you offer based on referral, or can folks that need assistance just walk in the door?
Absolutely not. Referral is not necessary for inpatient treatment or outpatient treatment. You can walk in 24/7 without a referral and receive an assessment.
I love that you said something about virtual assessments, because if that's one thing that COVID gave us, was that ability to really feel comfortable and lean into the virtual side of things. And speak a little bit more to that. You guys offer that as well.
Absolutely. So if we have a staff member available, which normally we do offer virtual and telephone assessments if the patient is not able to get transportation here, or there's a barrier for them coming in for treatment. We can do the assessment virtually or over the phone.
And you kind of spoke to that master level clinician piece of it. How does that differ from, I guess, just a regular level clinician?
Well, all of our clinicians are master's level, and most of them are licensed as well. So you're able to get that clinical aspect of it, and really like a crisis intervention with a master's level therapist. So there is really a clinical side to that as well.
I also really appreciate that this is 24 hours a day, 7 days a week, because you never really know when something like this may spring up.
Absolutely. Crisis can happen anytime, so we're available 24/7 for that reason.
Perfect. So you mentioned just walking through the door. Would you be able to take someone if they did have a referral?
Absolutely. We do welcome referrals, but again, they are not necessary.
And how many spaces do you have available here?
We have 92 beds here.
So you're able to serve the masses at just about any given time?
Absolutely. Ages 4 into adulthood.
Perfect, Danae. Thank you very much.
No problem. Thank you.
Well, we talked to Danae about the patient side of things. We now have Charlotte Terrell with us. Thanks for being here.
Absolutely.
Haven't seen you in a little while.
I know, it's been a while.
Good to see you again.
Good to see you also.
Well, let's talk about the support side. So while there are patients who will need your services here, we can't forget about the caretakers for those patients who also need support.
Absolutely. A lot of people, sometimes they forget about themselves. They get so caught up in the whole hustle and bustle of trying to take care that they forget about caring for themselves. And self-care is not just an option, it's essential. So you have to do what's right to be able to pour into others and provide that service.
Well, we hear about self-care all the time, and we hear about self-care in your personal life, self-care in your professional life, and you're right. I feel like we have to definitely pay attention to those folks who are caring for others, because you don't want one person that has needs to turn into 2 people that have needs.
Absolutely. You have to set boundaries. You have to know what your limitations are. You have to be able to solicit help when you need it yourself, and ask others when you need support, and not be afraid or not be too proud to say, hey, I'm sinking here, I need your help. So just making sure that you're taking care of yourself in that manner.
For those people who might be watching right now who are caretakers, what are some of those signs that they may need to also seek some help themselves?
Crying spells, not wanting to get out of bed, not enjoying the things that you used to enjoy, feeling like the only thing that you have to do is take care of this person. And you have a life. You had a life before that person, and you need to continue to have a life, even though you're taking care and you're the primary care person for that situation.
Well, because you're taking a lot of responsibility on yourself, and there comes time when you might not be a skilled person, or you may not have the education behind you to really help that individual, and you might need to be seeking that second opinion, I guess, for somebody who really knows what's going on and can recognize these things maybe a little faster than you can.
Right, and at that point, you need to tap into the community resources. We have a myriad of resources in the community where you can identify those needs, and especially when you get to a point where you're at a crisis, you need to know and be able to tap into those sources.
Surely. Let's talk about another subject, bullying. That's a big thing that's happening. I mean, it's everywhere. We've lived in a bubble for a long time here in South Mississippi where we don't deal with a lot of things that are happening on a national scale, but that is beginning to find its way here. You hear about it all the time. Let's talk a little bit about that.
And it's not just with children, it's with adults as well. I had a friend, unfortunately, who completed suicide, who was being bullied by the president of the university that she worked at. So being bullied is not only an epidemic that's happening, it's also something that needs to be handled by exemplifying kindness, teaching kindness, coaching kindness, and being kind, because you don't know what people are going through.
That's a very common statement that you hear. I'm glad you said that. Everybody has something that they're going through that you know nothing about.
Right.
And I know it sounds maybe a little cliche to say, be nice, be
Right.
kind.
Right.
Just know that going into every interaction that you're dealing with someone who may be having underlying issues you know nothing about that you could be making worse.
Right. And it doesn't cost a thing. Compassion does not cost a thing. But somebody's life may be in the balance if you are not cognizant of the fact that they are going through something. But just be nice just because it's the right thing to do.
Right? It feels better.
Right.
I mean, you don't want to start out the door, being mean to people. I know we all.
Right. We
everybody
have
bad days. We all
Right.
have them.
We know that.
But you don't want to let it spiral into something else.
Exactly.
Anxiety. That's a conversation. I feel like I'm literally triggering myself here because I feel like I have some issues with anxiety from time to time. But when do people need to start seeking additional help or seeking another layer of help?
When it becomes debilitating, where you can't even function. I remember myself, I had a panic attack and I felt like I was going to die, and I was driving. So you have to really stop and think and breathe and just take time and say, you know what? I need to just be still for a moment. Maybe if you pray. Sing a song, say a scripture, say a poem, say something to get you back on track, and just take that moment to take care of yourself.
But what if you have those moments in the middle of something else that you're doing that's also important?
Deep breathing is, believe it or not, number one, and it works really well. Just taking time to breathe. We take these shallow breaths and sometimes we forget to breathe, but when you're having a moment of anxiety, taking a deep breath, just taking time to think, taking time to slow those racing thoughts, it does help.
I know this is a difficult conversation. So, what if you have a family member that you know is experiencing sort of like a panic attack or an anxiety attack? That you're only doing this to yourself. There are things that you can say that make matters significantly worse. We don't have to cover those, but what about those moments where, how do you help them?
I'm listening, I'm here, breathe, reminding them to breathe as well. Giving them something to distract them, helping them just kind of work through it slowly. I know that you may not be a professional, but you can most certainly be a human and talk with them and just be kind to them and showing them that it's okay, just breathe, take your time.
Absolutely. Well, you see that information there at the bottom of your screen. Give them a call if you need help, or if you don't know you need help, you just feel something a little different, give them a call. You see those numbers there at the bottom of your screen. Charlotte, thanks for being here.
Thank you so much.